What is an anti-inflammatory diet? An anti-inflammatory diet focuses on incorporating certain healthy foods to reduce chronic inflammation in the body. This includes increasing consumption of omega-3 fatty acids, commonly found in fatty fish such as salmon or tuna, as well as nuts and seeds. Vitamin C is a powerful antioxidant, commonly found in oranges and bell peppers, that can help reduce cellular stress. An increase in lean protein sources and whole grains is also emphasized in this diet. Pro-inflammatory foods, such as artificial sugars and highly processed foods, are advised against. What is breast cancer? Breast cancer is the second most common cancer in women and the second leading cause of cancer death in women. It is caused by rapid and uncontrollable cellular division in the breast. Breast cancer has a high rate of metastasis at around 20 to 30%, meaning 1 in 3 cases will metastasize. Breast cancer can originate in many areas of the breast, such as the nipple, ducts, fatty tissues, and lobes. Breast cancer has genetic and environmental risk factors. Genetic risk factors include BRCA mutations, BRCA1 and BRCA2, and environmental risk factors include activity level, alcohol consumption, and diet. Can adopting an anti-inflammatory diet reduce the risk of breast cancer? A 2025 study published by Cambridge University examined plant-based diets and inflammation biomarkers among women with breast cancer. They found that women who ate a healthful plant-based diet had lower systematic inflammation levels than women who ate an unhealthy diet. The HPDI denotes the healthy diet, and the UPDI denotes the unhealthy diet. As you can see, the systematic inflammation levels highlighted here are much lower than women who ate an unhealthy diet. The pro-inflammatory cytokines are also significantly lower in women who ate a healthy diet than women who ate an unhealthy diet. While this study does involve patients who actively have breast cancer, this still shows that systematic inflammation can be reduced with a healthy diet. Examine maternal fish oil consumption on tumorigenesis in mice offspring. The FF denotes both maternal and offspring consumption of fish oil diet. The FC denotes maternal consumption of fish oil in the diet and offspring consumption of corn oil in the diet. The CF denotes the opposite, maternal consumption of corn oil in the diet and offspring consumption of fish oil in the diet. The CC was the control group, denoting both mother and offspring containing diets of corn oil. They found that mice who consumed fish oil in any capacity had lower rates of tumorigenesis versus the control group who had no maternal or offspring consumption. The mice used in this study were genetically engineered to be predisposed to breast cancer, and while this research was not done in humans, it is promising in confirming the necessity of omega-3 in the diet and its potential to reduce tumor growth across lifespans. So what does this all mean? While there is no way to fully prevent breast cancer, we can take steps to reduce our risk by making better eating choices and adopting elements of the anti-inflammatory diet to reduce systematic inflammation in the body that causes breast cancer. As previously stated, we should increase our consumption of omega-3 fatty acids, while keeping in mind the 5:1 to 10:1 ratio of omega-6 to omega-3 fatty acids necessary in our diet. We should increase our consumption of antioxidants, such as vitamin C, as well as reach for lean protein sources rather than fatty ones, and whole grains rather than refined grains. We should avoid overly processed meats, dairy, snacks, and artificial sugars. This diet, in conjunction with reduced alcohol consumption, which for women is 1 or few drinks a day, and increased activity levels, can allow us to modify our environmental risk factors. Research is being conducted on breast cancer all across the globe and even right here on UMass's campus. With the help of researchers and your own daily choices, we can work together to reduce our risk. For more details on breast cancer, you can visit the American Cancer Society's website. Thank you so much for listening, and I hope that you learned something today.